Alright, hello everybody. I'm going to show you how to do our ABORh in gel procedure by manual method. Excuse any noise, I am in the lab recording right now during the workday. So here is our card for our ABORh gel method. You can see as A, B, D, our control, and then our back type will be A1 and B cells. So remember when we did the 1 and 2 screen cells in gel, and I told you it's different than our 1, 2, and 3 because it's a different dilution. So the same thing is true with our A1 and B cells. So these are a 0.8% dilution of A1 and B cells. These are used for gel method as opposed to our normal A1 and B cells that are used in tube method. So this is what we'll be using today. So to start off, usually you use these small tubes, but I've said before that pipette tips don't really fit very well in the small tubes. So we'll be using these larger 12 tubes, okay? So the first thing you're gonna wanna do is you're gonna wanna take 2 tubes. You're gonna label them with the patient's initials, one with just patient initials and one with patient initials and 3 to 5%. Our patient today is Z test dog. So the first one we're gonna label with ZD, and the second one we're gonna label with ZD 3 to 5%, okay? So in our first tube that just has the patient initials, we're gonna take some red cells out of our sample and we're gonna put them in that tube. So we'll go ahead and put those in that tube, okay? Now we are going to dispense, we have our diluent here, our MTS diluent. We're gonna use a pipette and we're gonna get about 1 ml into this tube labeled 3 to 5%. You can see there's graduated marks on the side. You can go up to the 1 ml point and put that in there, okay? Then we are gonna take our pipette. Yours will look a little bit different, but you wanna go over and you wanna get it to 50 microliters. Okay. And you want to put 50 microliters of the red cells into the diluent. Just like that. And then we're done with this tube. You can go ahead and get rid of this tube. Now you're going to take a pipette and you're going to mix this thoroughly. Okay, now we're going to take this card here and we're going to label it. So we want to put our patient's information. So Z test dog. And then we'll also put a ID number. So this is 133 36598. Okay. And at this point you want to check your gel, make sure there's no drying or excessive bubbles. Take off your foil. You're going to take your pipette and you're going to get back to 10 microliters. And then you want to pipette 10 microliters of your patient cells into the A, B, D, and control. All right, and you can tap this slightly to make sure everything's down into the well. Okay. Then for our A1 and B cells, what you want to do is you're going to shake your cells just like we do with every other red cell reagent to make sure there's nothing on the bottom. Okay, that looks good. And then you're going to take your pipette and put it back to 50. Okay. And you want to do 50 of your A1 in the A1 spot. A new pipette tip. 50 of your B cells in your B spot. And then, as we know, our back type uses patient plasma, so we're going to go ahead and do 50 of patient plasma in each of those back type wells. New pipette tip. We'll do 50. Because I touched the side of the well, I'm going to go ahead and add a new pipette tip. Okay. All right. And then we want to label our back type so we know what's in that well. So we're going to label it as A1 and B, C. Okay. Now this is going to go in a centrifuge, and it's going to spin for 9 to 10 minutes. So we'll go ahead and do that. So our ABORh in gel is getting ready to be finished spinning. So let's go ahead and look at our worksheet on page 18. As you can see, there's 4 patients and there's a tube and a gel for each of them. So you're going to do 4 different patients. You're going to do their ABORh in tube, and then you're going to do it in gel. So let's start on patient 2 here, since it's different than the one we did for tube. So this is Z test dog, and the ID number is 1333659 And as you can see on the gel, there is a decontrol spot. And remember, we did add a control to that card, so we will have a decontrol to record. And we'll talk a little bit about that once we read the card. And it's getting done spinning now, so I'm gonna go grab it. Okay, so here's our card. You can see it up close. So our A, we're going to read that. That is a negative reaction, so we're going to put a 0 down. Our B, that is a negative reaction, so we're going to put a 0 down. Our anti-D, that is a 4+ reaction, so we'll put the 4+ on our anti-D. Now our D control, your control should always be negative, and that is a negative reaction. So put a negative on your D control. Now our back type, our A1 cells are 4+. So back down here on the reverse type, we'll put 4+. And our B cells are also 4+. So we'll put 4+ down here. Now, we're gonna read that type. That type is an O pause. Make sure you write pause and not put a plus sign on your interpretation. So, if we had an AB pause on the gel card, we would not have to run a D control because we already have the control in the gel card. That's the nice thing about these gel cards. You wouldn't have to do a separate control because it's already been run with the control. However, if we do have a negative D on these cards, you're gonna have to do a weak D by 2 because we don't do a weak D in the gel card. Okay, so we have an O pause, our control is negative, so that is a good interpretation, and we're good to go on this type. And that's how you do a manual gel card ABO.